Scattered across Georgia, from the rural outskirts to the urban hubs, are clinicians perched on the cutting edge of the very technology revolutionizing the delivery of care, electronic medical records, EMRs. A crop of clinicians, many of whom are early adopters of EMRs, are leading a march in concert with the Georgia Health Information Regional Extension Center at the National Center for Primary Care at Morehouse School of Medicine to champion the cause of adopting EMRs. This video is a snapshot of some of their stories from the front lines of their journey through selection, implementation, and meaningful use. At Decatur Pediatric Group, providers crisscross the central waiting station, darting in and out of exam rooms. Children of all ages come in with various expressions, but all seem to leave with a smile. That look of concern that parents walk in with is replaced with a sense of comfort. They know that their most prized assets, their children, are in good hands with Dr. Melinda Willingham and Dr. Lynette Wilson Phillips. And when you speak to these two doctors, you find out one of the reasons they are so comfortable with what they do is the certainty offered by their electronic medical record system. Facilitating the change for staff was also regular access to webinars, live in-house trainings, and friendly competitions, rewarding the most comprehensive users. Making this process even easier for everyone involved was the role played by the Georgia Health Information Technology Regional Extension Center.
I believe that they had a lot of expertise or knowledge in the process itself, so it really gave us a guideline as far as what things we needed to do.
With 3 different locations for care, it's vital that they manage an efficient system. These offices require treatment of various clientele, but the expectation of quality care doesn't waver.
This system has allowed us for legibility, for ease of access. With the present system that we use, if we've done a complete physical exam on a patient that basically hasn't changed with the subsequent visit, this is a simple click of a button that identifies that the physical exam has not changed. If we have a list of the diagnosis from previous visits, all it is updating that diagnosis, just simply clicking on it, and it regenerates and repopulates that particular visit, indicating that the diagnosis is the same, and if the management is pretty much the same, we can just simply input that without having to detail it out.
On the roads leading to the offices of the Dublin Women's Center, you can see stems of plant life sprouting cotton. It's a reminder of the rural surroundings Dr. Mark L. Bowles and his team of clinicians have flourished in. With a fervent desire to increase efficiency and maintain the value of his practice, Dr. Bowles worked with the GA-HITREC to get an EMR.
I just can't overemphasize the importance they played in our transition. I wish, now one of the mistakes that I made is, again, I told you how I went about choosing our system. I wish that I had known about the Regional Extension Center so I could have gotten more advice from them on which system to go with. But once they're completely vendor neutral, it doesn't matter what system you go with, they come in and assist you.
His story, like those who have come before him, was one of lost records, hard to read prescriptions, and missing data. And like his predecessors, he turned to EMRs for a change.
Well, my favorite language is birth language. It's kind of like pregnancy and birth. To begin with, you're excited about it. Then in the middle and the end of the pregnancy, it totally stinks. And could this baby ever come out? Will we ever get there? And then when you finally get to the point of labor, it's difficult. The transition is very hard. Transition in labor is terribly hard. And then when you finally have your product in place, in this situation, the electronic medical records, you love your baby, and it's wonderful.
Just off the strip of the urban-stained Old National Parkway in College Park, where so many businesses sit barren, silently articulating the dark financial hardship of the community, rests a bright spot, Kid Care Pediatrics. The walls glow with images of Mickey Mouse and Dora the Explorer in hopes of offering the families a getaway from some of the harder images these patients have become accustomed to. The small team of 3 physicians is led by the founder of the practice, Dr. Helena Bentley. She's been doing it her way for 23 years, so the idea of EMRs is a major adjustment.
When the electronic medical records came on, it was a little difficult for me because I'm not a computer savvy person, I'm not a typist, so it takes a little bit more time for me to adjust to the keyboard to do it.
She benefits from being surrounded by a team of young tech-savvy employees who embrace the efficiency brought by effective technology. So as Dr. Bentley struggles with the idea of having to adjust to some of the changes brought about by her new EMR system, SweetMed, she praises the future of not having to thumb through hundreds of files to find the one she needs, or even worse, losing a file. Being a pediatrician, she appreciates the color and various templates her system offers, which makes delivering care easier and better.
I'm in pediatrics. I like colorful things, and the pages on the template are a little bit more colorful than some of the other systems that I've seen. So that it was more aesthetically pleasing to me at first. Then when I got into the templates, I didn't have to redo everything about the template.
Although she openly admits to being technically challenged, Dr. Bentley was sharp enough to get a system that was certified for meaningful use and to partner with the Georgia Health Information Technology Regional Extension Center. Her staff loves the convenience of a system that makes so much accessible. Shalonda remembers the day, not too long ago, when a simple phone call from a parent asking a question about their child's weight could easily turn into a 10-minute venture through paper records, creating a frustrated patient base.
The patients are very happy about their transition. They could tell the difference versus Shalonda, what was my child's last weight, and I could click and tell them versus, okay, Miss Stevens, I'm gonna have to call you back once I go and pull the chart. So they could tell the difference right then and there. I think they're very happy about it.
When you walk into Kids First Pediatrics in Stockbridge, you expect them to be on the cutting edge of the most recent technology. The waiting room is decorated with studio-quality pictures of newborns on canvas-style frames. A reception desk serves as the modern-day gatekeeper to a highly competitive team of providers. The current crew of providers has occupied the current location for 5 years, but from its pristine look, it can be argued that they have barely been there 5 months. It's no surprise when you learn they aren't newcomers to EMRs. Rather, they have assembled a team of providers and staff who are pushing the benefits of having a system to the limits, improving workflow efficiencies, and proactive billing at an optimal rate. This has allowed for Kids First to offer the children who they care for the best care possible, and that hasn't stopped them from striving to do even better. But it wasn't always like this. The providers and staff can vividly recall a time when things weren't this efficient. A time without an EMR that forced them to cling to paper records, deciphering poor handwriting, and billing in a reactive manner.
Before electronic medical records, we were writing everything. So we would get charts, and we would, to start, the chart would start in the front, and then they would sign the patient in, and then we'd get the paperwork, and then we would fill out the chart, just handwriting everything. And then from there, when I finished with the chart, if they needed a referral, for example, we would have to physically give the chart to the person who did the referral. So sometimes if there were labs that needed to be done or something like that, there was a matter of trying to find the chart and keeping up with the chart.
The team of 3 pediatricians and a nurse practitioner slowly embarked into the world of EMRs, first using a combination of paper and digital for several weeks before a full electronic commitment. For the providers, this slow baptism was a deliberate attempt to cater to their low-tech deficiencies. It has paid off perfectly for the clinicians.
Of course, we've always provided top quality care, but having access to what medicine was given, the vital signs right there to look up in an orderly fashion, the orthostatics, having dates of service right there at a first glance on one page, having the diagnosis at first glance, it made it easier to go through a patient's chart quickly and get a synopsis of what's been going on with them versus leafing through lots of papers and, again, deciphering diagnosis or medication names.
But providers aren't the only ones benefiting from this technological shift. Annette Smith remembers being excited enough to do cartwheels when she heard the practice was moving to EMRs. As the billing specialist, she remembers losing workdays solely on trying to track down misplaced paper records or spending endless time going back and forth with insurance companies about payment.
With the electronic medical records, I have a turnaround on my claims. Like if I send them every day. That's what I do first thing in the morning. I send them out. And on Medicaid, I get them in, as long as I send them in by 12 o'clock on Friday, I get a turnaround of the next week, the very next week. Each week, I'm getting in money, every week. There's not a week that I'm not getting in money, and I don't mean it's coming in once a week. It starts coming in on Tuesday, and it doesn't stop until Thursday.
In his office, cluttered with family pictures, awards, and tokens of appreciation, Dr. Wynne Kelly sits with an irrepressible smile. Often the life of the party, his staff credits his quick sense of humor for making their hefty patient load at Primary Pediatrics in Macon, Georgia, manageable. The other thing that adds to the manageability of the large, ever-changing patient base is EMRs. But it wasn't always like that. Dr. Calais remembers a time when tracking missing records and his staff struggling with his poor penmanship was the norm. It slowed efficiencies, stagnated growth, and sent the staff on expeditions for misplaced records. That was until he agreed to implement the EMR system, and even after doing that, things weren't easy.
No matter what happens, and you start with an electronic medical record, the first week is going to be a total disaster. And I don't care how you slice it and how well you train. There is a learning curve to almost all of what you do.
But through it all, he stayed focused on his goal: patient care. His borderline obsession with EMR is grounded in his conviction of assuring that his patients receive the best care. He leaves no doubt that he's willing to do whatever it takes to get his patients the best care possible.
It is paramount in terms of being able to share that data with other physicians or other providers in your community with your electronic medical record to ensure that your patient gets the best care. So it is clearly going to prevent medical error, and it is clearly the best patient care.
Along with improved patient care, Dr. Calais was able to create some order in his life, get some free time due to newfound efficiencies, and not be handcuffed with the responsibility of completing endless paper records. And as the system helped to revolutionize his life, it served as a great benefit for his staff.
I have access, I can type their name in and their birth date, and I have access to everything. We've had it for about 3.5 years, and for the last 3.5 years, I can pull up anything and everything that has gone on with them, including if they were referred to another doctor, I can pull up notes from another doctor. You know, I can pull up anything for the last 3.5 years on that patient.
For some, the jury is still out on whether the temporary stall in workflow or the questionable return on investment makes EMRs worth the commitment. But the one consistent message that resonates throughout the dialogue is it increases the quality of patient care. So the question you should ask yourself if you don't have a system is, how important is that for you?